messages. I come at this from a very different approach. I come at this from a practitioner approach. Somebody who's not affiliated now with the university, but who basically did all his learning curves outside of a university. And everything that I'm going to present to you today is material that I learned from my patients and learned from clinical observations. So it's a very different approach than Beverly has. This is as I say, a country boy treating patients and trying to understand what's going on in the context of energy medicine and whole body healing. So I named this talk Electrical Informational Fields. I define fields as bodies of information, and we'll go through that. Okay, now I come from Northeast Georgia, a little town called Lakemont, where the women are intelligent and hardworking, the children a little bit above average, and the men as dumb as foxes. But foxes may not be that intelligent. We take our deer hunting extremely seriously. But getting back to something that is more relevant is, where did I get my learning and my training? And as I said, I had my training from patients, from years of clinical experience of watching things that work and don't work. And this was one of Bill Halstead's statements, which has always had tremendous meaning for me as a practicing physician. And as the hospital, the operating room, the ward should be laboratories of the highest order. We practice medicine, but we practice medicine in order to learn from our patients, which means you have to listen to your patients. Now, I've worked with folks who have had a lot of public media. We supplied wound dressings to this group of folks, the Tour de France team. We were able to keep them with our wound dressings, cycling without pain, and actually accelerated the wound healing. But I also work with patients who never make the media, who never who never get any public notice. And this is the Redneck Olympics in North Georgia. This poor lady never got any attention. You never heard about her. But I also work with folks, with patients who never make the media, but patients who break your heart, patients who are very, very sick. This is a very seriously full body thickness burn patient. This is what drives me. This is what keeps me going and what makes me want to try to understand the theory. Now, I like what this is one of my favorite quotes. Scientific progress is made funeral by funeral. This is Max Planck. I call it, I'm dealing in a world of myopic, constipated thinking. And that's when I deal with my colleagues, I have to confront these issues and try to bring new technologies in. Now, I was kind of blessed in the sense that I worked with a patient population that was very willing to try new technologies. This was a rural population who, if it worked, they would be willing to use it. And they were my subjects, which I learned most from. And this is how I learned what informational fields were all about. Now, informational fields, the physical informational field, which everybody knows, this is a pharmaceutical model. This is a model where you apply toxins with beneficial side effects. That's my definition of pharmaceuticals. And if you keep that definition, you can practice fairly good medicine. But there are other areas of informational fields. In this case, I call electrical informational fields, and that's what I'll present some information to you about. Then we have the area of magnetic informational fields, which at this conference, Dr. Pollack is one of the experts, world experts in this field, which I'm very blessed and pleased that he's here. We have electromagnetic informational fields. And we also have, and again, I clump this together, I call them quantum informational fields. Now, of these three fields, most of us work in the physical informational fields. Some are getting into electrical informational fields, very few in magnetic, some in electromagnetic informational fields. And this is probably the biggest gathering of people that I've been in that looks at quantum informational fields and tries to look at it. Now, if I just look at electrical informational fields, this comes back to a model that I started learning in the 1970s. Now, the take home here is, I call it the whole amphibian healing as opposed to the whole human healing. This is looking at amphibians and why amphibians heal. Now, if we take the salamander, and remove and amputate a limb, or we take a frog and amputate a limb, they have very different responses. The reason they have different responses, this is a take-home point, big take-home point, is that the animal is able to muster a field reversal response. Okay. When a species, or you can change the field, in this case the salamander, which is able to regrow an extremity, is able to go from a positive field coming out of the end of the extremity to totally reverse the field to a negative potential. The salamander is able to regrow that limb. The frog, however, is unable to muster that polarity shift, that change, and grow a new leg. So it just closes off the stump and that's it. Now, if we look at a salamander, and again, this is very complex, but I'll try to keep it very simple, and we look at how a limb regenerates in a salamander, it creates a group of cells called the blastema. This blastema is magic. This is where the quantum fields, the electromagnetic fields, the magnetic and the electrical fields all interact. This is where regeneration occurs, in the blastema. If you can create and maintain a blastema, you can grow a new extremity. This is where the information is carried from the DNA into the structural components to build a new limb. This is an electromagnetic field and a quantum field. Now, in orthopedics, what we try to do in wound healing, and what the body does naturally, is it does a field reversal. For example, let's say if we have a fracture, the fracture, which the bone is normally a negative polarity, the fracture becomes positive polarity. But the body trying to heal itself, the periosteum, which is a lining around the bone, creates a negative polarity. It maintains a negative polarity. And you can see where the negative polarity shifts very high in the periosteum, which then carries information back to the bone to change the polarity of the bone, and the bone knits together and heals. Now, in a non-union, in a bone that doesn't heal, this polarity doesn't shift. So what Becker did, and a bunch of folks in the 70s, and this is where I cut my teeth, is we were putting wires in the middle of these bones and changing the electrical field. We were trying to do what nature does naturally. If you want to get on the cutting edge of discovery, do what Einstein said, is copy nature. And that's what we're trying to do, and that's what we're doing in this model. If it's not healing, we encourage it to heal by reversing the field. Again, another area of tissue healing, regeneration by field reversal. Now, my area right now is skin. I'm very interested in skin and wound healing and all aspects of wound healing, whether it's old or whether it's young. Now, this is a little education. This is called the epidermis, and this is the dermis. These cells actually pump positive ions from this layer, the cornified epithelial layer, down through to the basement membrane. So if you're moving ions, what you're doing is you're creating an electric potential. So the skin is electrically negative in potential to the deeper tissues. Now what happens in an injury? The potential reverses. The skin now becomes positive. So what we try to do in this very simplistic model to copy nature is we try to put something on the surface of the body that's highly conductive to rebalance the electrical potential. It's not really difficult when you think about it. Now, the folks at Purdue did some really good basic science research. And this was in the 80s. Borgens headed up the group in Ben Abel. They were measuring electrical surface potentials. Well, what's interesting is when you have a pathological process going on in the body, these electrical potentials, which are negative voltages, negative millivoltages, these potentials become positive. If I measure the electrical potential over a carpal tunnel syndrome, or over a fibrocystic mass in the breast, or over a carcinoma, a fibrosarcoma in the body, what I'll see is a positive shift of the potential. Okay, so this is where the body's saying something's out of balance and out of whack. Now, if I take the simplest of the simple systems, wound healing, and this is the laceration in the skin, this is the electrical model, what happens is the electrical potential changes here, becomes less negative, more positive. But why can the salamander regenerate? Because the salamander is able to have built into their hardwiring the ability to reverse the field. They reverse the field and they get a less positive and get better energy flow. And when the energy flow is coming through, in this case it's reflected in the electromagnetic or an electrical field, it can also be represented in a quantum field or a chi field. Energy flows and healing starts to occur. We're creating a field reversal. Now, this is just another model. I'll move on rapidly. It's just to try to create the electrical circuits that are involved here. Now, this is Becker and Nordenstrom are my two heroes in the sense of understanding mechanisms. Nordenstrom did a whole thing called closed biological circuits. This is absolutely critical. If you could think in terms of everything being a closed biological circuit, to do what? To maintain an electrical separation of charge. If I had one thing to do to change in a body, I would change the extracellular electrical potential. If I could go back and create what an embryo has, minus 70 millivolts, that is the voltage inside the cell relative to the voltage outside the cell, then what I call an adaptogenic healing response. The body will actually balance itself, and all these complex biochemical pathways will occur spontaneously. So energy healer comes in, puts energy in, rebalances, changes polarity, and bingo, you have healing. You don't have to know these complex metabolic pathways, although they are very important. I'll explain a little bit later. Now, electromagnetic informational fields. These are a couple of the parameters. This is where I think we're headed, whereas we put a specific energy pattern into the body with information, and then the body responds. So the signaling is not a chemical signaling. The signaling is an electromagnetic signaling. That's where I think we're headed. Now, these are the fundamentals in bioelectric fields and bioelectric field work. What carries a charge? It's not an electron, it's an ion. So think in terms of ion movement. Second fundamental principle is what creates the electric field in the body. We have membranes, junctions between cells, we have active and passive channels. These are the processes which pump the ions, which create the field separation and the field differences. And then that creates what I call the polarity of the field. And it's the polarity of the field that gets changed in wounds. Now, I'm going to talk about two subjects real simply: conductive fabrics. We're going to talk passive and active, and I'll show you how they work in a clinical setting, in wound healing, and chemical interaction. The pharmaceutical model is not all wrong, but if I understand this process and then design my chemicals to interact with this process, I can have better chemicals, that I can have drugs with less toxicity and more, quote, beneficial side effects. So I'm trying to alter the ion movement. I'll show you how we can do that. Now, this is what I played with. This is what Becker introduced me to 35 years ago. We were taking silver-plated fabrics, we call conductive fabrics, and applying these to wounds. Bob was using this primarily initially for the application of silver, but in reality, it changes the electrical surface potential. This was a company that we went to in the early 70s to make these fabrics. Subsequently, I do my own plating and have done the plating. The products were developed for electromagnetic shielding. NATO picked up on this a couple years ago and built a poncho called the Ghost, which gives the IR shielding, near and far IR. But that's how that, and this was the fellow I learned from. This is a fellow who's really set my career in motion. This is Bob Becker in the 70s, and I'll talk a little about him tonight on an intro. But these are the type of cases we were dealing with. Complex osteomyelitis cases. This was a BA patient came in for a BK amputation with a fail. But this guy went on, walked out of there with this technology. We were putting wires, running electricity, changing field reversals in bones. And in that process, we were able to get these bones to heal when basically they're going into an amputation mode. Published in 1978, we had an 87% success rate with this technology. Mass General had a 72% success rate with a procedure that was 40 times more expensive, 20 times more complex, and they only had 72%. But they got lead article in New England Journal of Medicine. We just got a lead article in Journal of Bone and Joint Surgery. We were never able to bring this out to the public, and there are many reasons why I'll talk about tonight. This is the type of cases I saw as a practicing orthopedic surgeon. This is a patient, snowmobile accident, had too much surgery. I inherited this from a colleague. So what happens, this gets infected, breaks down, and now we're dealing with internal fixation hardware that's infected, and we have a very serious problem. And I'll show you, this is one of my cases that I really like. The wound broke down to histamine, it breaks down, gets infected. And we then did this technique in the 80s where we took tobramycin, put it in beads to try to create an antimicrobial effect. That failed. We did gastrox flap. That failed. We did 9 more surgical procedures, which were basically removing debris, from the area, and now this guy's left with a hole. We started him on this technique. This is a bone scan. The black means inflammation or infection, so the guy has a terrible knee, basically set up for it. Actually, it was an above-knee amputation where he'd come in. So we decided to use this new technology. These are the bugs growing out of his leg. I mean, it's a swamp. It's a zoo, as we heard the other day. Now, this is what impressed me about this technology. I'm reversing the field. See this little bunch of tissue here? This is granulation tissue that's growing out of the version canal system of the bone. Okay? That doesn't happen with other techniques, but it happens if you're able to reverse the field. This is 53 days later. The patient's just doing his own dressing changes. And we could have done a skin graft at this time. He didn't want any more surgery. He'd been through 12 or 14 procedures. He said, I just want to let this heal on its own. It went and healed on its own. And here's a 2-year follow-up or a 3-year follow-up. It's not a great picture, but it shows a functional leg that he's walking on that basically saved for, and he'd come in for above-knee amputation. Then again, these are folks from my practice. I'll show you the variety. This is a post-trauma. M80 went off in this kid's hand. I inherited this from a colleague who was on call that night. We got this kid with changing surface polarities. We had this kid totally rehabbed and functional. This is a partial thickness burn. The child's walking on this foot. Okay, with this type of injury, if you're able to create a field reversal. And that's what we are able to do in this specific case with a highly conductive fabric. And this is what we're doing now. We're doing complex burn cases. This is a skin graft, and I'll show you how we're able to change the healing rates of it. And we're using materials that interact with the body. Conductive fabric. It's great that they're silver, it's great that they're antimicrobial, but really the take-home message is it's conductive material that interacts with the biological system. This is material we used in the 70s. This is parachute material. This material is still active today, the same material we used in the 70s. So what's the shelf life of this, quote, drug? It's 30 years. I mean, it's a great material. This is another type. And again, we've developed this into many different configurations. This just shows a fabric. This is more conductive than a copper wire. We put a thin coat of silver around there. Now, this is what's interesting. When we plate fabrics, this show a blow up, the very fine layer of silver, we can change our plating characteristic. This is a tunneling electron microscope. Now, this is what's exciting to me. We can get into the idea of making sentient materials by applying electromagnetic energies to manufacturing processes. So we can change the way the silver is laid down by the energetic field that we put into the water. And we're doing that right now today. What you're seeing in these cases is stuff that I've developed over 30 years. This is the type of wound. This is one of the complications we get in. These are cellular debris, primarily glycocalyx, material bacteria secrete. Okay? We developed a technique where we can actually dissolve these biofilms in glycocalyx by reversing the polarity of the bacteria. Which is another way of looking at it. Now we heard about this. This is hot in wound healing, by the way. All the major 5 wound healing companies in the world today are using silver in wound healing because it has the therapeutic spectrum of silver is huge. That is, it takes micrograms, nanograms to kill bacteria, but the toxicity level is in the gram or high milligram level. So it's very effective. This is where we started. We were taking product, putting it on culture plates, showing how we're able to kill bacteria under it. This is really what Bob did. But this is one of the mechanisms of how this works. Now, this comes out of China. Excellent work. This is an electron micrograph of an E. coli cell with silver on it. It interacts, the take-home point here, interacts with cellular membranes. Okay? The silver interacts with the membrane, which changes the electrical potential, which then causes a cell apoptosis, or in this case, a cell death. Now, wound healing was moisture control in the 70s, 80s, microbial protection in the 90s and this century. And I'm telling you, in the next 30 years, wound dressings and wound healing will have to do with transepithelial skin potentials, reversing electrical potentials. Okay, and that's where it's so exciting because everything you're doing here and what you're learning in these alternative therapies all relate to understanding how to change reverse fields. I'm doing this in a mechanical way, but it doesn't have to. Now, I'll show you a couple cases. People who came to Penn State last summer saw some of these. We took just coronary artery bypass graft surgery. This is 72 hours after using this type of dressing, changing potentials. Patient's pain level is just about 0. When you change the potential, you do a field reversal over a wound. And most infections occur 30 days out of a hospital. We decrease the infection rate by 50%. That's lots and lots of money. The insurance companies hear those statistics. They like those facts because that saves them money. Now, I'll show you a couple of clinical cases. These are all my patients from North Georgia. This is a young gal, head went through a windshield, negative head CT, but we're left with this huge laceration. Now, 2 principles. If we can reverse the polarity on the surface of the skin, at the same time creating an antimicrobial environment, we can get a good result. Because it's edema which creates the scar tissue. We can control the edema by doing those 2 very simple things. We took her back to the OR the next day. We rotted her femur. But you see where the conductive fabrics were not on her body, not on her face, on her eyelid, it was ecchymotic. Where it was on her face, there was some ecchymosis, but that's 3-4 days out from a major trauma. And you'll see there's no swelling. Okay, that's what you get when you do field reversals in wound healing. Now, we took the stitches out in 5 days. This is 10 days out. It was still, you're not really sure what it's going to look like. But then when we take her out 212 days, this is her result. Okay? And this is basically what we started with. Again, simple stuff. Field reversals. Okay, electrical potentials. This is one of my great cases. I love this case. This is a workman's comp injury that came in to see me, amputation right through the base of the nail. Okay, got his finger caught in the door. We did, and again, he has streaming electrical potentials. On that tip, we did a field reversal. We kept the right moisture conditions, basically created the right electrical environment. And if you do that, you can get some pretty amazing results. 17 days out, 39 days out, we stopped the dressings. And at 88 days out, this is the kid's finger, fully functional, normal sensation. Now, when I give this talk, see the dirt under his nail? That means he doesn't have a digital neuroma. 15 to 20% of these get neuromas and they can't use a digit because the nerve, when it regrows back in an abnormal way and creates a significant pain response. Now, the fellow didn't get any workman's comp money for this case. Okay? There was no settlement because he was back to normal with a normal digit. He was 21, he wanted the normal digit, didn't want the settlement. That's what we started with. Okay, and just one last case. This is a soft tissue infection. This is the kind of stuff you see in the third world. You can take this product or these concepts of conductive materials, put them on wounds. In India, when I do volunteer work there, we take the product off, wash it in a stream basically, and put it back on the wound and last for 2 weeks. So we're able to create an antimicrobial environment, but we're able to reverse the polarity shift that occurred in that wound. This is the new paradigm. This is the paradigm that I use the word myopic mental constipation because when I present this paradigm to my colleagues, they fall asleep. They don't want to listen. So if I measure the electrical skin potential, it's minus 70, minus 50 millivolts, minus 30, minus 50 millivolts. If I measure it over a wound, what happens, it becomes positive, the polarity reverses. If I put a material across there, passive or actively, that's actually able to reverse the polarity, bingo, I get these wounds to heal with no more surgery. It's not rocket science. It's 262 days out. This was a very difficult case. He drank a 6-pack of beer a day, smoked 2 packs of cigarettes a day. As I say, had poor protoplasm. But again, he still went on to heal. This is an area I have great interest in. Thermal burns. I have about 5 more minutes, so am I doing okay? Yeah, I got about 8 minutes. Okay, cool. Thermal burns is an area that I have great interest in personally, where we take these materials and put these on wounds, apply them, have them in many different configurations. We can apply. Now, this is a wound graft. Okay, so this is an area we've grafted skin from one part of the body to the. This is 3 days out. Okay, this is equal to a skin graft 6 days out. The graft is stable and is starting to fill in where it's been meshed. Now, at 5 days out, this is healed, which normally takes 12 days. Now, what's the value of this technology to an insurance company? Huge. This saves them money. What's the value to the patient? They get a better clinical result. So it's a win-win situation. But the hardest part is changing the mental mindset of the physicians to look at a new paradigm of thinking about wounds. That's a long-term follow-up. Vet cases, I like this case because animals don't lie. Now, what I learned on this case, on the vet cases that we've done, is that if we put a material on the body that alters the electrical response, the animal doesn't chew the dressing off. If the animal doesn't chew it off, it'll heal. I mean, animals are wonderful wound healing models because the mind doesn't get involved with the model. Okay, surprises. This is where clinical observation, this is where you learn from in the process. And this is, we're sitting in the year is 1977. We're at the VA hospital. We're doing rounds with Bob Becker. We see this on the dressing, and we make a swab of this and send it down to the pathologist. The pathologist comes back and says, what'd you do, a bone marrow biopsy? And we said, no, we took a smear from the dressing. Well, what we discovered, and that set us on a whole path of looking at how we're able to change cells. This just shows a new wound dressing, but we have the same, this is a white cell reaction, but it also creates a milieu of cells which do have very interesting, I can't use the word progenitor cell or stem cell, but we're able to get some type of dedifferentiation in these fibroblasts. Now, this is one of the great things that Bob Becker gave, and I think this is my testimony to him of one of his great discoveries. He found that if he takes a certain distance from an electrode, that it has a very specific electric field and a very specific ion concentration, he would get these mature fibroblasts to turn into these type of cells. Those are fibroblasts. That's not what fibroblasts look like. They look like these cells down here, pictorially. Okay. This is a cell that has altered its morphology. We use the word dedifferentiation, but we didn't know what that word meant in the 1970s. You know, is this a progenitor cell? Is this a stem cell? Probably not. But this is an altered cell that's able to make more copies of itself by doing a field reversal and applying the electromagnetic field. And this is where we took a culture out of a patient. These are the cells that were created 6 days later from this culture. So these cells have been changed to create this large number of cells. Okay, altering electrical surface potentials. This is what I've had fun with for the last 20 years. It's that we're taking material. This is a dislocated elbow. The total medial complex here, the elbow's ripped out. This is 7 days out. I wrapped the patient with this silver nylon conductive material, put him in a cast, came back 7 days. There was no ecchymosis from here to here. This would have been black without this technology, without doing a field reversal on the surface of the skin. But where the silver nylon didn't touch the body down here, there you have an ecchymosis. We didn't do a field reversal down there. We didn't do a field reversal at the wrist where the material wasn't touching. So now we're able to influence processes in the body by using conductive materials. I had a 90% total resolution of carpal tunnel syndrome by having the patient wear a conductive garment 24/7. We were doing some experiment with fibrocystic breast disease. These are dots that were on the 22nd of October, 99. Blue dots were a month later by putting a conductive fabric over the breast. Women wore it 24/7, and we were able to change internal pathology by changing surface pathology. If I measured the electrical potentials on this breast, over every one of these red dots, I would see a field of polarity reversal. I would see it become get less negative and shift into the positive range. Now, we also have fun by changing frontal lobe activity by making masks out of this, which is a really interesting meditative technique for the people who like to meditate. The product will slow down the activity in the frontal lobe, or change it, I should say. And we have fun we make garments for horses, and again, we have a lot of fun playing with this material. One last thought. Informational fields can also occur in a chemical way. We have physical informational fields and electrical. Now, in the physical informational fields, this is what I'm doing at the University of Georgia now. We're playing with electron membrane potentials. And we're playing with these potentials by changing the ion characteristics on the surface of these cells. And we're altering membrane integrity. By changing membrane integrity, by changing polarity, we can also wipe out biofilms, and this is why bacteria kill. They create a biofilm, protect themselves, and prevent the antibiotics from getting at them. We can do that and without a cytotoxic effect. Now, what we're doing is we're coming in chemically and changing the ionic nature on the glycocalyx around the bacteria. When we change that, we're able to alter the activity of that cell. We're altering the transmembrane potential. So this is a typical MRSA. This is an MRSA that's been altered by changing its potential. We're basically putting holes in the membrane. And we're selectively doing that. So we can take now any antimicrobial, any, let's say, an MRSA bacteria that's resistant to penicillin, take 1/10 the original dose of penicillin, mix it with this potentiator, this membrane alteration material, and kill the MRSA. Okay, we don't need a new drug. All we need is a potentiator that has to do with dealing with transmembrane potentials. And there's no resistance in time. But what's really neat is we can take silver, and this is one of the things we're doing here. We can take silver, mix it with this potentiator. Now we have a natural antimicrobial. It's really interesting. But this goes back to you change the paradigm, we learn the new paradigm, and this gives us new vistas into designing new processes, which each one of us do in our own way. Thank you. That's a very good question. I'm not a commercial person, I'm a scientist. That product could probably cost, and my business people would probably kick me, but you could probably retail it out for $25. The typical workman's comp case is settled for $40,000 today, 13 to 15 for the hospital physician, surgery, and because 40% don't go back to work, another 25,000 in cash settlement to the patient. So we're dealing with something that might cost $40 to $40,000. That's a good question. You have to use a silver chloride electrode, and you have to put your reference electrode. That's the key. You got to create your reference electrode, so and this is where the variation occurs. And then you just keep measuring around. You can use a fairly simple voltmeter and measure around once you have your right reference, and you can measure your voltage. If you took a simple voltmeter, and started playing around in your skin today, put an electrode here, you would see a negative potential. So then you have to try pressure techniques, and so you get a uniform reading, because you have different layers, different quantified epithelial layers in different people. It's not an easy measurement. If they were cystic lesions, yes. If they are thick, dense, fibrotic lesions, we didn't follow them up long enough. My answer is probably yes. If it was cancer, absolutely not.
How long did it take for the cyst to resolve?
Oh, this was 30 days.
Wow.
Yeah. But remember, they're manipulative techniques for reducing cysts by right energy work. I mean, I would say a good Qigong practitioner could put energy in there, and the cyst is gone in 24 hours. Yeah, I mean, this is a slow technique relative to the energies. Yes? How long will it take before this is mainstream? This all depends upon the business economics, okay? I'm not a good businessman. I don't pretend to be a good businessman. But with the right team of people, this technology could be in 6 months on topicals.
I mean, if there's a crisis, you got the market. The market is already there.
Right. Well, remember, I was joking when I put that first slide up there, being a country hick from North Georgia. I mean, I don't mingle in those circles. I don't go to Wall Street. I don't bring in the money or bring in the business people. I'm not successful at that. I always keep my fingers crossed that an angel will come along that's interested in this technology and able to put it out into mainstream, because it's very powerful.